All right, and welcome everyone to TMA's first webinar of Myositis Awareness Month. Today's webinar, Living Well with Myositis, is proudly hosted by the Myositis Association, founded in 1993. TMA's mission is to improve the lives of people affected by myositis through patient support, education, advocacy, and the advancement of research. We're honored to continue this work alongside patients, care partners, medical professionals, and advocates across the globe. As we gather today, it's especially meaningful that we do so during Myositis Awareness Month. This annual observance, recognized every May, was created to shine a light on the rare group of diseases known as myositis, conditions that involve chronic muscle inflammation and can affect people of all ages. Since its inception, Myositis Awareness Month has grown into a powerful movement that raises public awareness, encourages early diagnosis, promotes research, and amplifies the voices of those living with this challenging condition. My name is Rachel Bromley, and I'm the Senior Manager of Patient Education, Support, and Advocacy at TMA. I'll be the moderator of today's panel of simply incredible myositis advocates and human beings. I am truly excited for all that we're going to learn together today. We're so glad you're here to be part of this important conversation. Let's dive in and explore how to live well with myositis together. I'm going to share my slides. So one moment. All right. Before we get started, can everyone see my slides? Could some person say yes?
I see notes, Rachel.
Okay, one moment. Thank you. I need to put it into present mode. All right. How about now?
I still see notes. I think it's the screen that needs switching.
Okay. Is anyone else not? Oh, okay. Hold on. I see. Okay. How about now?
Yep, perfect.
Great. All right. Thank you, everyone. I appreciate your patience. Before we get started, our disclaimer, TMA does not give medical advice, and we ask every speaker to disclose any potential conflicts at the start of their presentation. This webinar is being recorded and will be available on TMA's YouTube channel next month. Please put any questions you have in the Q&A box. Any questions put in the chat box may be missed. Applicable questions submitted when you registered are being entered into the Q&A by TMA staff, so no need to submit again. Questions that do not pertain specifically to this webinar may be answered in future programming. And for fun, feel free to use the chat to share where you are joining us from. I am broadcasting from the TMA office in Columbia, Maryland. Meet our amazing panelists. One moment, I am going to, I want to stop highlighting myself. So just give me 1 second. And I will go. All right, Karen, please go first.
Hi, everyone. I'm Karen Cheng. I was initially diagnosed with polymyositis in 2006 when I was living in Singapore. I was hospitalized for 4.5 months and wheelchair dependent for about 1.5 years. But I did recover, and I took the myositis with me to work in Tokyo, Boston, and now I'm based in Basel, Switzerland. And last year, we confirmed that I have anti-SRP immune-mediated necrotizing myopathy, or IMNM. I serve pro bono on several myositis international organizations, and I also work full-time in a pharmaceutical company here in Basel, which focuses on rare diseases. I'm very active and very independent as well, and I'm very grateful for this extraordinary life that I have, even with myositis.
Thank you so much, Karen. We really appreciate you. Next, we have Veronica Fatura. You're on mute.
Okay. Hello.
Hey, we can hear you.
Yeah, okay. Hello, everyone. My name is Veronica Fatura. I am Mexican, and I lead the Michigan Support Group and the Adelante Affinity Group. I was diagnosed with dermatomyositis in February 2021, and I am currently participating in the Valor study with Dr. Ventura when they're trying to find a new medication for dermatomyositis. And that's it about me.
All right, thank you so much. And then up next, we have Holly Jones.
Hi, everyone. I am Holly Jones. I am living with polymyositis with interstitial lung disease, pulmonary hypertension, congestive heart failure, and vasovagal syncope, which is a lot. I got diagnosed in 2003 at the age of 19. I am the leader for the Women of Color Affinity Group here at the Myositis Association, and I also serve on the board of directors here at the Myositis Association. This is my 4th year, and I have enjoyed every year of being a part of this community since 2019. Outside of that, I'm in Houston. I'm sorry, I was supposed to give my location. I live in Houston, Texas. So if there's anybody out here that is looking for support, give me a quick email or a shout out or a call.
That's great. Thank you so much. All right, next we have Colleen Layton. You're on mute. So just unmute yourself.
Hi, my name is Colleen Layton. I live in central New Jersey. I was diagnosed with anti-SRP in 2012 at the age of 43. I am the New Jersey support group leader, and I look forward to gathering more members. We're fairly new. We've only been up about a year.
Yes, thank you so much for reactivating that local group. Okay, and so next we have her husband. One moment, I'm replacing the spotlight. There you go, John Layton, welcome.
Hi, my name is John Layton, care partner for Colleen Layton. I live in central New Jersey. My goal is to make Colleen's life the best possible, and whatever we can do to do that, to have a normal, active life.
Yes,
So-
and both Colleen and John come to every annual patient conference, and they volunteer, and so they really let me put them to work, and I appreciate that. So, all right, next we have Silke Schutler.
Hi everyone, my name is Silke Flüter. I am from Germany. I was diagnosed in 2012 with polymyositis and 2015 with overlap myositis. I am the chairwoman of the German Myositis Group and the German Society for Muscle Diseases. I am also on the board of the International Myositis Society and the Myositis Nets.
Thank you for the work you do. We really appreciate you. All right, we have Suds, go ahead.
Hi, good afternoon or good day, everybody, wherever you're coming from. Jim Sudzik. I live in Wisconsin, in Menominee Falls, Wisconsin, which is right outside of Milwaukee, Wisconsin. I try to help out in the worldwide myositis meetings every first Saturday of every month. I also participate in the men's myositis. I also participate with the veterans group and also in the Wisconsin group. I was diagnosed with inclusion body myositis back in 2004. So when you're talking about myositis and inclusion body myositis, you talk about the stages. So I've been in the early stages, the middle stages, and now I'm in the 4th quarter stages. So and I want that stage to continue for as long as we can. So I'm excited about being here. Thank you.
Thank you, Suds. All right, one moment. So next, what we're going to do, we'll do another round robin, and each panelist will spend about 3 minutes each talking about what does living well mean to them personally and what they've learned along the way that helps them live well with myositis. And I want to start by saying, No toxic positivity here. We're not saying that it's everything is sunshine and rainbows and we can stay happy all the time. Absolutely not. We acknowledge the challenges that each of you face and look forward to hearing how you do shift away from the sadness and struggle when you can. So, Karen, would you like to start?
Sure. So I had a lot of time to think about the life that I still wanted to have, because I spent 4.5 months in hospital when I was diagnosed. Of course, it was a bit of a shock for me because I went from normal to completely bedridden in 6 weeks. My medical team told me that I may never be able to do the things that I once did, such as running, hiking, rock climbing, scuba diving, so, and also at that time I was still working in hospitals and clinics, so I had a very demanding job as an oral surgeon. So preparing myself mentally for a very different life was very difficult. But also I think there was a little bit of a rebel in me because when my doctors told me they were not sure if I could go scuba diving again, and I was like, just watch me, So I think this early denial of how bad a health situation I was in made me want to beat it even more. And also wanting to get back in the water was my mental and physical rehabilitation. So the water was really great for me. I had, challenges with gravity, and I think many of us who do have muscle weakness, this is a daily struggle. From the moment that you wake up, you feel the gravity on you. And so I loved water therapy. I insisted to have as much time in the pool as much as I could while I was still very weak. And I hired a swim instructor actually to help me rehabilitate. There wasn't actually hydrotherapy in Singapore at that time. And so I got stronger, and finally, when I could go back to scuba diving again, I really appreciated that because I always felt stronger and happier, after I came back from a dive trip. Another thing that I learned from myositis, and this is something that I still am very much, geared for today, is to not rely on people to do things that we otherwise take for granted. So I live alone. Well, I live alone with 2 cats. So, and I also have a very busy and active social and work life. And some of you might even have heard that I just say I don't have time to be sick. But, we have to recognize that sometimes you do need to just take a step back and be sick and recover from that. So getting things done by myself was something that I really wanted to do because that was taken away from me when I was first diagnosed. So getting out of bed every day, washing yourself, putting on your own clothes, feeding yourself, cleaning your own home, getting up from a chair or toilet yourself. These were the things that I really, really wanted to do again, when I was first sick. So I know that some people might say, okay, this kind of hyper independence might be a bit of a trauma reaction, but I actually learned that trauma actually kept me going. I wanted to do it more because I was so traumatized by the whole initial experience when I was first diagnosed. So being fully independent, both physically, emotionally, and financially, was one of the things that I aimed to restore back into my life after I got myositis. I had to pivot my career. I had to force myself to do an MBA. I had to find a new way of earning, my own keep. And I found a way to live with myositis, and it really is a great life. If people ask me, do I want to get rid of myositis? Well, yeah, it would be nice, but I also quite appreciate it because it's taught me a different way of living. And so today I because I'm much better physically as well, that I can give back some of my time and experience to this community and to support, others who are going through a difficult time as well. So that's basically my story. I have a lot of other tips. I've seen a lot of your questions, and I will be happy to answer later on in this webinar.
Thank you so much. And I want to encourage people that if you are living alone or you don't have anyone in your house that can provide care, you are welcome to attend TMA's Flying Solo. It's on the first Wednesday of every month. It may or may not work for your time zone, but I want to know that you're more than welcome because I do feel that people who live alone, we all could use the extra support, right? And I too have one cat and one dog, and they're my life. But I love my myositis community too. So the questions that you give to us, please make sure that they relate to living well. I know many of you have so many questions, and we have Ask the Experts coming up that can help you with that. You're free to answer each other's questions in the chat, but just remember that we don't give medical advice. We can talk about what does and doesn't work for us, but we always encourage everybody to make decisions in partnership with their health care team. So, who is next? I don't have it. Veronica. All right, Veronica, thank you so much.
Hi, everyone. Well, for me, it was not it was shocking more than when they told me you have dermatomyositis. The first question was, what is that? I was totally clueless. I was lucky enough that I was diagnosed in a month and a half after I had my first symptoms. And it took me for a little bit, but I think with the help of my father and my family, I learned that living well with myositis is understanding that myositis is a permanent guest in my body, doesn't define who I am, may sometimes define what and what I can do, but that's not who I am. So that kind of helps me. Also, something that helped me to go through or to process faster the situation that I was going into is something that my father always taught me. He always told me that there was two important qualities that you should have in life. And one is adaptability, because there will be always things that you can control or you can change. So you need to adapt to your new circumstances. And the second one was gratitude. He was so strong on that, about never forget the people who help you and always be thankful for what you have. So maybe my father, without knowing, he was preparing me for this. Dermatomyositis is my new circumstance, and I'm adapting. Now I must protect myself from the sun. I had to change my diet. I have to work in my endurance. I have to visit doctors more often. And I have to adapt and finding joy in new things. I am thankful definitely for the support and knowledge that I get from TMA and for my support groups. I'm happy for all the new friends that I have. I'm thankful for the love and support from my husband, and that my daughters make me feel that they still need me, and that being sick didn't change that. My daughters, for who doesn't know me, are the most important thing in my life. So being sick, I thought will alterate my relationship with them. And I learned that that was not the case. So thanks to myositis, I found how strong I am. And I realized that I'm stronger than I never thought. I have learned to ask for help, which is really, really hard for me. I'm the kind of person that, how can I help you? How can I help you? But asking for help was hard for me. So now, thanks to DM, thanks to the training that I get in TMA, I know how to say I need help. So when I need to cry, it's valid. I cry. But when I'm done crying, like, okay, I took my time to cry, to take it out. But then immediately I'm a rebel in that aspect. I don't like to be sad. So I try immediately to look for something that makes me happy, that brings me joy. So I look for Latin music. I look for a picture of my daughters, putting my dog on my lap. It's little things, but you learn to appreciate that simple things so much. Even going shopping. If I want to go shopping and that makes me happy, why not? So I'm realizing that I'm strong, that I learned to advocate for myself, and that's a really important skill that we need to have. Advocate for ourselves, because the more information we have, the better questions or suggestions we can give to our doctors. And also, the better organized we are with our medical history, the easier it is for our doctors to help us and to work as team. Because my doctors, I have like 3 different doctors, but they work as a team. They communicate and I exchange information for them. So, in few words, I can tell you, I learned thanks to dermatomyositis that happiness is not what my body can or can do. Happiness for me now is enjoying every good circumstance or moment that it comes into my life and be thankful for the blessings I have. I don't have time to be pity about myself. Sometimes it's hard, I won't deny, but I think that's what happiness is that for me, and I'm thankful for myositis teach me that. I hope that helps
So
someone, and I hope to be able to answer a few questions over there. Thank you, everyone.
yes, any of the panelists that feel led to, you can put your email in the chat, not required, but you are free to. And I just want to say hi to the person in Sugar Land, Texas, because that's kind of my neck of the woods. So welcome. And we also have several people from all over the world. So that is nice. I hope you can make the next TMA worldwide. It used to be for 2 years, it was called nationwide, but it's a good time slot for some other time zones. And so we recently updated the name to more actually apply to all the people that come to it. So next up, we have Holly Jones.
Hi, everyone. And I'm a Texas girly. I'm in Houston, live in Porter, actually in the greater Houston area. So the person from Sugar Land reached out to me. So I got asked the question of living well with myositis. I thought of so many different ways of how I live well, and I was trying to think of how I can condense it down. And I want to champion Veronica for saying that her father laid a foundation, because that is one of the avenues that I thought about speaking about, was how my parents instilled faith in me, taught me how to believe in God. If you don't believe in God, to believe in something that anchors you. And so being a woman of faith, it boils down to me these few points that I wrote down. And it is the practice for me of the serenity prayer, the golden rule, which is something that was instilled in me as a child. My mom was an educator. So that was one of the first things that I learned about being selfless and treating people the way you want to be treated. I live off of the scripture of Romans 12:12, which is to be joyful in hope, patient in affliction, and faithful in prayer. And I've also established an understanding and a relationship with my faith, with God, that whatever quality of life, what it looks like for me and for him. Everybody has their own definition of quality of life. So many doctors since I was 19 years old told me that I would have a poor quality of life. When I got pregnant with my children, they told me that I would not survive, or that I would have a poor quality of life. And I just determined what that level looks like for me. I won't go into detail because I want this to be a positive webinar, but I have defined what poor quality of life looks like for me. And as you can see today, that is not the definition for me. And so an extension of that is that I also make a conscious effort to love others with an empathetic heart, to practice forgiveness, practice gratitude, and having the wisdom to know that living well also comes at a cost. It is not easily given, like without some form of sacrifice. To protect your wellness, you must set boundaries from others and certain activities that you know will hinder your wellness. And you must be disciplined in self-reflection by holding yourself accountable, by embracing humility and remaining humble. And none of these things are easily accomplished without taking a conscious effort daily to live well. It's hard, but yet it's a rewarding task if you never give up on your goal to live well, as you learn to adapt to life's challenges and opportunities to grow. So that's my condensed, I guess, message of how I choose to live well. I try to take every small moment, every small victory to celebrate. When I'm sad, when I'm hurt, when depression takes over, I turn to my faith. I turn to my husband who prays over me. I turn to my children who I am grateful for. And I have a village of like-minded people. Please don't underestimate your village. Surround yourself with people who believe in your values, your morals. They may not have the same religion. I have plenty of friends who do not have the same religion as me, but we have the same core values. They have the same characteristics of an empathetic heart and loving others first and giving back and being a person who loves to be a servant, who loves to serve. So make sure that your lifestyle and your village is what you want it to be, how you define it. It is your life, and you can only determine the quality of your life. And pretty much living well is not easy. It is not easy, but you have to make that effort every day, because you have to realize with myositis, with any autoimmune disease, when we're sleeping, we're fighting a battle. When we wake up, when I'm sitting on the couch, my heart is walking. When I'm walking, my heart is running. So I'm constantly fighting. And that's why we always say that you guys are myositis warriors, that we are warriors, that we are conquerors, because we are constantly fighting 24 hours a day. And yet we show up for family, we show up for friends, often putting ourselves on the back burner, and we show up with a smile. So many people cannot believe the things I have gone through with this disease for over 20 plus years. And I still get the phrase, "You don't look sick." I don't understand it. You show up smiling and everything, and I used to get so upset. I want a lot of people on here who are like newly diagnosed. When someone, I'm gonna wrap up, Rachel, I'm sorry. When someone tells you that you don't look sick, I'm telling you, they used to eat me up in my core. But turn it around, be positive, and say thank you instead of getting upset and arguing with them. If they say you don't look sick, turn that around and tell yourself that is a compliment, because they are seeing all the hard work, all the time and effort you have put into your body, into your mind, into your spirit, into your daily living of living well. That is what they see. So that's why they say you don't look sick. That is why they can't wrap their mind around how you're thriving, not surviving, thriving in this disease, that you are living well. So when someone says you don't look sick, or I don't understand, yesterday you did this, and that, that's because you have put in the work, and you should be proud of yourself. So embrace those negative comments, flip it, make them positive, and just say, thank you. I know I don't know how I do it, but I'm doing it. So I'm done, Rachel, because I can start preaching and let out all kinds of scriptures in a second.
I know, Holly, I could have just had a panel of one, just had you on here, but we have plenty of time. Like I said, we're going to go until we're done. So we will still have time for Q&A, and this is being recorded if you can't stay on. So let's now move on to Colleen Layton. You have to unmute.
There we go. I
Hey.
took a lot from what Holly just said.
Me too.
And was hugely helpful, Holly, because I very often struggle. I still work. I work as a nurse. I used to work in a hospital setting. 2 years ago, I was unable. I worked med surge, which is tremendously physically taxing. I couldn't do it. I found a lovely small home care agency to work for, and now I'm a case manager. But to have people doubt your diagnosis and doubt how you are feeling, it is very tough to deal with. So I appreciate that advice, and I'm going to take it moving forward. Hugely helpful. When I was first diagnosed, I struggled with the change it brought to my life. We're extremely active. We do a lot of volunteer work. I was a firefighter. I was an EMT. I worked as a nurse, and I found myself unable to do a lot of those things. So you find new activities, you find new ways to challenge yourself. It's a little bit hard to start initially challenging yourself in a different manner, but the challenges are there. You just have to put the time in to find them. I am blessed to have a really great care partner who finds ways for us to continue being active and doing things. He's quite the out of the box thinker. And leading the support group for the last little more than a year has been really enlightening. I've learned a lot from the members, and I have gotten a lot of new hobbies that either give me a different way to be physically active or maybe expend less energy. I've taken a lot of support from my own inner circle, both family and friends. And I think it was Holly who also said you have to be able to set boundaries, and you have to be able to, the relationship shouldn't drain you. And when it drains you, that's giving you less resilience with which to fight this battle. So thank you for that, Holly. I am trying very hard to embrace my myositis wellness, and I get more and more motivated by being a part of TMA and my support group every time we have a meeting. So I hope that continues.
Thank you so much, Colleen. We really appreciate that. And I am so happy to introduce your husband, mainly because he is the only person on the panel that is a care partner. And we always want to hug and love on and appreciate and include our care partners. And we're very eager to hear about his experience. But John, your wife is listening. She's on the same panel. So what's your words?
So living well with myositis. So when Colleen was first diagnosed, it's a little bit of life changing. We learned how to deal with people differently. We had learned how to do stuff differently. And I'm kind of a stubborn person, so I did whatever possible to make Colleen's life, as normal as it was, before she was diagnosed. I'm very outgoing. I think we're both very outgoing. We have a lot of activities, and we stay busy all the time. Living well with myositis, it's different. So you just find ways to adapt. Sometimes the way Colleen walks, she can't walk in crowds, she can't walk up and down stairs fast. So I know that mentally really affects her, and the way I have to look at it so that she is comfortable, and the way I have to do a couple things differently, like walking with her in crowds and things like that. It's a little bit of adjustment for me to do, but we do it, and it makes our life better and easier to do what we do every day.
Yes, John, but you are such a care partner. I hear it all the time. Most of what you've talked about has been about how you support Colleen, but how do you support yourself?
So myself, I'm pretty independent. I have times where I go out by myself and do my thing that we do. I'm very active with people. Like, I'm a construction worker, I'm a boss. I deal with people all day long, so I'm very active with people. So I really don't get frustrated with Colleen, but sometimes I just have to go and do what I do, by myself, and just step away, do yard work, we live on a farm, so constantly out doing stuff like that. But as far as
Well,
taking care of myself, go ahead.
Go ahead. No, you go ahead.
So as far as taking care of myself, I mean, very active. I mean, we have horses, we do all kind of things. So we stay active in the sport of what we do. I do stuff with Colleen. I do stuff independently there. I'm very active in a lot of groups, president of a lot of organizations. So my time is spent there, and that's how I take care of myself.
Well, I would like it if, and the reason I know I can ask this is because I've asked it before and you guys have shared this story publicly, but I absolutely love the story that you guys have about learning to be nice and communicate well. So would you like to share that story, please?
Yeah. So Colleen's a very independent person. This disease is hard for her to ask for help or anything like that, but as any of you know, everybody has their issues. So there was one time in particular, it was cold outside. We were doing stuff in the yard. Colleen had fallen, and I went to help her get up. And, I got the attitude where I don't need your help to get up, that I'll get myself up in time. So finally I said, that's the way you want to do it. So I just walked away, went and did some things outside, and I came back a little while later, and then she was willing to accept my help to get her up. So that's a hard thing for some people to do, but hard for people to accept help. But I'm always there to help when I need to. So sometimes as being a care partner, the person you're caring for, has to learn to accept the help that people are offering them.
Absolutely. Colleen, you want to?
There's those boundaries Holly was talking about. I believe his exact words were, "You aren't going to talk to me this way. I'm happy to help you, but you're not going to talk to me that way."
So I did clean it up a little bit.
You did clean it up, but it's okay. We're all family here. And that is the experience of the care partner. And for the patient too, because when you're in that relationship, it is easy to get frustrated and not use the right words. So boundaries are good. Thank you so much for being here, John. Next, we are going to Silke.
Thank you. I said that I have overlap myositis, but my history of illness starts in 1990 when I was diagnosed with autoimmune hepatitis at the age of 14. So I grew up with a serious chronic autoimmune disease. Over the next years, I had appointments at various departments due to increasing many symptoms. Then I was diagnosed with polymyositis in 2012. In 2015, the doctors changed the diagnosis to overlap myositis. My overlap myositis includes myositis, Sjögren and Renault syndrome, problems with the esophagus, autoimmune gastritis, and polyneuropathy, myasthenia gravis, and autoimmune thyreopathy. My overlap myositis is a complicated overlapping picture that requires the involvement of many different specialists and departments. This interplay of different symptoms and diagnoses is a great challenge for the doctors and for me. Other challenges for me in coping with the illness include coping with activities of daily living, meeting friends, doing the housework, visits to therapists, doctors, etc. Coping with the side effects of the medication, coping with the false expectations of the environment. You often seem healthy, but you aren't. Holly said, "You don't look sick." Yeah, I heard it very often. Allocating energy resources. Do I have a shower or do I have to do some chores? Following medication and non-medication treatment instructions. Use of assistive devices such as a walker, wheelchair, etc. Pay attention to mental health. I learned that living with overlap myositis is like a roller coaster ride. Every day is a challenge. No 2 days are the same. It's a disease with many ups and downs. Living with myositis is not easy, but accepting it with a positive attitude makes it easier to cope with the daily activities, medication instructions, and side effects of the therapy. Become an expert of your own disease. Many doctors, therapists, and others are not familiar with myositis. Use aids like walker, wheelchairs, etc. to make your life as easy as possible. It's important to manage your energy and look after your mental well-being. Do hobbies and have fun. If no longer, for example, as a motorcyclist, then as a passenger. Breaks, hobbies, and lots of fun help enormously to ensure that I have enough energy to cope with my life and get involved in voluntary work. What keeps me going in my own illness is helping others like me. This is very close to my heart. I serve in a few organizations dedicating to improving the lives of people living with myositis. These activities keep me busy, are fun, and give me the feeling of doing something meaningful. Thank you.
Thank you so much. All right, and next we will have Suds.
Hi, everybody. I looked at those questions and it said, living well with myositis. Well, every day when I wake up, I think life is a blessing, and some of us have like different types of faith and everything. But every day when I wake up, I say, what is going to be first that's going to happen today in my life? And first thing is that I wake up, and then I have my caregivers here, my wife is here, my dog's here, and that brings me joy. But then, like, I sometimes go back in my mind and I remember the first time, or like when I was in grade school, the first time you buttoned a button, or when you were learning as a kid, you got to tie your shoes, things that I can't do anymore. But I remember that was a first. So a first thing that comes up every day in your life is a first, no matter what that is. And you can say that this is the first time that this has ever happened to me, and that is a blessing. And how does this blessing occur? Well, because of myositis. And they always talk about when you get myositis. I remember when the doctor told me, he says, you have inclusion body myositis. Like a lot of us, we didn't know how to spell it, what it meant, or where we were going. And he told me, he said, enjoy your life now because there is no cure. Well, in my life, there's always been hope in my life. So I rely on hope every day. And I hope someday there will be a cure. Is there a cure right now? No, there's not a cure, but I can pray. Pray for that cure. I didn't give up the first time I got diagnosed. What I did, I went to Mayo Clinic up in Rochester, Minnesota. I talked to the hospital over in London. I talked to McGill University up in Montreal. I went to Children's Hospital down in Columbus, Ohio. For what? Hope. There's always hope that there's going to be a cure for myositis, whether it be poly, dermato, or inclusion body myositis. That brings me joy in my life, and that's fun. They talked about the road on myositis. Everybody has their own road that they travel with myositis, whatever your myositis is. So I started thinking about where would I go to find out what's going to be on this road. Well, if you're traveling, you go to AAA and you get the map. You find out where you're going, how long it's going to take you, what you're going to see on the way, where you want to stop, who you might want to talk to, what events you want to participate in. Well, AAA doesn't have a map for inclusion body myositis. What does have a map for myositis is TMA, not AAA, but TMA. So I used TMA to open up new doors for my life. I got to meet some great people and continue to meet great people every day. Just like on this seminar, we're meeting new people every day. You're learning from other people, the people that are on this panel, people that are not on this panel. We will learn from each other. I learn from my wife. I learn from my dog. I learn from my caregivers. I learn from people that come into my life. And people come into your life and people leave your life. We lost somebody in our life this past weekend. That was very emotional. And we all cried together. We all had a wonderful emotional time, but we celebrated Randy's life. And we'll continue to celebrate other lives as we travel through our own life. So we have to remember that. What other things give me uh, pleasure in life or enjoying life is sharing with other people, trying to be kind to other people, trying to educate other people, being educated by others. That's what life is. And you talk about pleasurable things. Rachel asked me once, well, what gives you really joy or pleasure? And I said, well, just ice cream. You know, now I'm getting dysphagia, so I can't really do a lot of ice cream. I can still do ice cream, but I have to do it slowly. That gives me pleasure. Um, Sharing with everybody else, um, going to different meetings. Um, and I haven't been to Holly's meeting down in Houston, but when I was in the clinical trial, that gave me pleasure and hope. But where did I have to go? I had to go to the Houston Muscle and Nerve and Muscle Center down in Houston, Texas, right across from MD Anderson down there, which is known basically for cancer. Um, but I got to meet a lot of wonderful people traveling to Houston on Southwest Airlines, stopping in St. Louis. We're traveling um, to DC one time when the plane got delayed or there was weather. But you get so many opportunities in your life every day in living that you want to continue living. You want to continue, and because you never know who you're going to bump into in life, and that's the joy and the pleasure of living. That gives me great joy, and I love that I'm still being able to communicate at this point. Like I did say, I have dysphagia, and I know what's coming down the road, but I don't know how many miles that is down the road yet. But it's great to share and 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 listen to others because I'm going to be learning more every day with you. So thank you very much.
Okay, let me remove the spotlight and then we are going to start the Q&A. All right, there we go. I'll start at the top. I'm not sure of everyone's, oh, I absolutely love that, Karen. What is your baby's name? Go ahead and come off. I mean, I gotta speak to the elephant in the room, or at least the kitty cat in the room. I don't know everybody's treatment plan on the call. So if none of us is on IVIG, just let me know. But we had a question for tips for work-life balance with IVIG.
I could maybe just quickly answer that. So I've been on IVIG for, gosh, since 2013, so nearly 15 years now. I've been on it monthly. Before 2013, I was on it on a needs basis. So if if my CK levels went up a little bit higher, then they would give me a dose. But since 2013, because I had my first relapse as well as cardiomyopathy, which is sometimes seen in myositis patients, not only for NTSRP IMNM, but it is a feature of NTSRP IMNM. So they put me on that every month now. I'm on a maintenance dose of 1 gram per kilogram body weight. And I always schedule it on a Friday because even though I know that I'm tolerating it very well and I don't get any, side effects, I know many of us here have, headaches or, feeling really worn out from IVIG. I typically am actually quite okay with IVIG, but I just, just to be safe, I schedule it on a Friday in case I do need the weekend to recover. It doesn't happen very often that I get a headache. I probably got one headache per year at the most, and it was quite easily resolved, with some headache medication.
Thank you so much, Karen. The next question is about IBM and SUDS. If you can't answer this, someone maybe in the audience can put some information in the chat. SUDS, have you ever worked with a physiatrist?
No, but I did go to Wisconsin Athletic Club, and I did work with trainers early on in the disease. And when you are first diagnosed with IBM, the best thing to do is keep moving, keep exercising as long as you can. I was in the beer business. Originally, I could lift a keg. And I went from kegs to just cases of beer. I went from cases of beer to 6 packs of beer. And then I went down to maybe a bottle of beer. And right now I can't even lift a bottle of beer. But if you can, and I did go to like a swimming type, aquatic type things, but keep working with as long as you can, as long as you have your muscles, keep working as long as you can. Because originally they told us not to exercise, but exercise we know now is a big part of maintaining your lifestyle as long as you can.
Thank you. For Veronica, what practical care tips have you used for heliotrope rash and Gotron's papules? If you have those on your knuckles and elbows, I'm not sure.
No, I didn't have problems with my knuckles and elbows. I just have really bad rashes on the front, which is the helicopter rash, and I also have the shell rash on the back. And in my eyes, actually, even now my eyes still a little bit red, but they don't hurt. So in my case, I think what it helped first is that I was diagnosed right away. I heard a lot of stories about people who took 1 or 2 years to get diagnosed correctly. So that did help. And then honestly, having the doctor that really had experience on it and is willing to work with other doctors. The doctor that I had, she flat out told me, you know what? I know about dermatomyositis, but I'm not an expert. I want to start you with this medication. And then she asked me to go to the University of Michigan to see a doctor that was an expert in dermatomyositis. So I think what it helped me was having doctors that were willing to ask for help, and then just really is trying. Like the Plaquenil didn't do anything for me. I heard Plaquenil help others. And then in the TMA, there was information about these JAK inhibitors. So I asked about it. And I also, through TMA, I found Dr. Ventura. And I went to see her in Chicago. I know I have to travel 4 hours, but she finally was able to put together the pieces of the puzzle that helped with my irritation in my skin. In my case, the Octagam IVIG is the one that I was doing. It was approved for the FDA, and that did help me a lot with the skin. So I don't think it did help a lot with the muscle strength, but it did help me a lot with the skin rashes. The IVIG was great for me. But then I started the clinical trial and I switched to the medication with the clinical trial. So like I said in my speech, is like you really need to advocate for yourself. And you feel like your doctor is not willing to ask for help, look for a doctor that's willing to work as a team with other doctors. I have a rheumatologist, primary physician, a rheumatologist in Chicago, and a dermatologist. And they work together as a team and they communicate to each other and they help each other.
Thank you so much. This is for our international panelists. How has having the condition affected your ability to travel internationally? And either one of you or both can answer.
Do you mean myself and Silke?
Yes.
Okay,
The
because
rest of
I
us
think,
is feedback.
travel really applies to all of us. I don't think it's just myself and Silke, but just to share, when I first started going back to work, and my work really was an international job, so I did have to do a lot of. I was living out of a suitcase, literally. I had 2 to 3 trips every month. It was extremely exhausting, I must say. At that time, my strength was good enough for me that I could still climb the stairs, the stairs that go up to the plane. Today, I would prefer not to do that, just to reduce my risk of falling. So I usually get the lift, the truck that comes with the lift, and you do have to request that. I can still travel very easily, I would say. It just requires a little bit of planning ahead, to just arrange, these special transportation items. And of course, as well, in the airports, I request for the chair service if I know it's, especially in the large international airports, because getting from one terminal to the other is often very, it's like a marathon. So I think there are, it takes a bit of planning, but it's very doable. I travel by myself, and I know it can be quite scary for many of us as well to really just pack your bags and go and do what you want, without having to rely on anyone. I do encourage it. I know it's not for everybody, but to give it a try, it's really quite liberating. But please be very, very careful and do not fall if you can. Try and avoid that, because a lot of us are also very weak and we don't realize that.
We have about 1 minute left in the actual hour of the program, so I would like to thank any of the panelists that need to step off, and anybody else is welcome to stay, and we will continue with a couple more questions, and then I just have a few slides to close out, and we won't be going over 15 minutes past. So, speaking of falling, Jim. I'm sorry, Suds. You said you were diagnosed in 2004. You've been through all the quarters of the game. And what lessons did you learn with the falling?
It hurts when you hit the ground. What lessons did I learn? I learned to fall. I mean, I played sports in my life, so when I felt myself falling, I tried to like slide into second base, but you can see on my hands, if you could see my hands, some of my knuckles are really shot from hitting the ground. So because I don't walk anymore, that the anxiety of falling has left my body, so to speak, because I don't fall anymore. And I always used to listen to people. There was a guy here, Al McGuire, coached Marquette basketball, and there was another guy here, Kareem Abdul-Jabbar, and Bob Lanier. They played in the NBA, but when they got a little bit older, they said falling always hurts. And I'm only like 5'10". Those guys were well over 6 foot, but when they fell, it really hurt. So I had less space to go to hit the ground and everything. But you have to be very careful. If you feel at the point in your disease that your legs are getting weak, and use support. Use either the walking sticks, use a rollator, and like I'm in a wheelchair, so that's fine. I had to overcome that, but it became a badge of honor just to have the cane, because I ended up with my dad's cane for a while, and then my dad's rollator, and then the occupational therapist says, You got to get a rollator that's your size and everything. So make sure you get all that measured. But falling is not fun. I mean, we joke about it and stuff like that, but you can hit your head. I cracked my skull once and had many staples in there, but I overcame that. But falling, try to not fall if you can. Be safe every day. And if you do have an inclination of it, ask for help. There's a lot of people in your groups or around you in your own home teams that are willing to help you. And don't be afraid to ask.
Thank you. And with that, I wanted to share a story about one person with IBM that I met that he was so funny. What he decided to do was he could still walk and he walked everywhere, but he was starting to get close to having falls and he maybe had one or two. And he decided that everywhere he was going to go, he was going to wear a bike helmet. So he did not care what people thought about how he looked, and he wore that bike helmet walking everywhere, going to the post office. And sure enough, it did save him when he did have a fall that would have cracked his skull. So there's lots of people have different types of ways to adapt for sure. I am going to switch over to our slides. And what tips you guys have been putting so many great tips that you have for this community in the chat. And we encourage you to actually share that with TMA so that we will have a repository of tips and share them with everyone. So Linda has put that link in the chat. I wanted to make sure that everyone knows you're welcome to attend any TMA regional support group meeting, even if you don't live in that region. If you need support and or want to connect with others, please know you are welcome to jump on the next support group meeting on the calendar. That's what we're here for, to let you know you are not alone. And in the chat, we have the events calendar link, and then we also have list of all TMA groups by region. And then at the bottom are the affinity groups. I do want to stress that all the support and affinity groups are specifically for people who have the diagnosis or their care partners or family or friends. Industry professionals or healthcare professionals do not attend those safe spaces unless they are invited to speak. Since this title of this webinar was Living Well with Myositis, we wanted to just give a shout out, a little book recommendation for Dr. Julius Birnbaum, who has just published Living Well with Autoimmune Diseases. I started it on the airplane on my last trip, and it is excellent so far. And he will be speaking on our autoimmune ILD webinar that is May 13th. So the link for that may be in the chat. And then finally, we have a call to action. Ask your representative to co-sponsor HRES 277, and you can click on the link to find out more. So yes, thank you guys so much. Thank every single person that is on this call. Does anybody have the last minute something to say before you go? Okay, let me pull up my script here because I've got a little bit more.
Well, I'll say this in the honor of May, which is Myositis Awareness Month. At the end of my show, when I used to have my radio show, we would always say, be the voice and the echo. So today you heard our voices, you heard us tell our stories, you heard us give advice about living well. So please be our echo and go out into the community and raise awareness for myositis and share your story, because you just never know how far your echo will go.
Thank you. Before we close, I want to take a moment to thank our amazing panelists. Your honesty, strength, and willingness to share your experiences have truly made this webinar special. You are not only incredible myositis advocates, but like I said at the beginning, you are remarkable human beings. It is an honor to know each of you, and we are so grateful for the time and energy you've shared with us today. I also want to share an exciting new addition to Myositis Awareness Month. Now, if you are reading our emails, you may already know, but we are so proud to announce that for the first time ever, TMA is recognizing Diagnosis Days, a special initiative that highlights each myositis subtype individually. These days are dedicated to raising awareness, providing education, and fostering connection within our community. Our first Diagnosis Day will be observed this Thursday, May 7th, and will feature a full day of events, including an Ask the Expert webinar, IBM edition, and a cafe chat social hour. Please, you can register for these events through our events calendar on the TMA website. We hope you'll join us. Thank you again for being here, for your support, and for being part of this powerful community. Together, we are living well with myositis. Thank you.